Thank you for joining us as we celebrate a historic moment in our state and nation's history. Today, with Governor Stitt and federal legislative representatives and many valued public and private partners, we're going to share more details about a new global health innovation and excellence initiative that will propel Oklahoma to the forefront of public health preparedness and response. This initiative will leverage Oklahoma's state and federal resources, both rural and urban, coupled with private research and developmental efforts to build a world-class initiative. At this time, we'd like to thank Senator Thompson and all state and federal officials who are here to help us commemorate such a historic occasion. I'd now like to welcome Governor Kevin Stitt to the podium to get us started.
Thank you so much, Dr. Fry. I really appreciate all you've done in the Department of Health to keep Oklahomans healthy and safe during this time. Today is a milestone day for the future of the public health response in the great state of Oklahoma. I'd like to formally announce the Oklahoma Pandemic Center for Innovation and Excellence. This will be the first of its kind in the entire nation. It will combine agriculture, human medicine, food safety, public health testing and preparedness, and animal safety, animal health. This center will serve as the state's front line of defense, protecting against any future disease that threatens the health and lives of Oklahomans. It will also leverage Oklahoma's unique rural and urban assets to benefit public health. The Oklahoma Pandemic Center will bring together local and national experts. It will include partnering with Oklahoma State University, the University of Oklahoma, the OSU College of Veterinary Medicine, and many other public and private sectors. This is a big tent because Oklahoma has many areas of expertise. We will lean on everyone to build a world-class center for pandemic preparedness. The Oklahoma State Department of Health is moving here to the Sandridge Center in the heart of downtown Oklahoma City. That allows us to think differently about how to elevate Oklahoma's science and innovation on a national stage. As a result, the Public Health Laboratory will be moving to Stillwater by the end of the year. It will serve as a pillar of the Oklahoma Pandemic Center. The long-term strategy is to expand the Public Health Lab to include the Pandemic Center. That will allow us to leverage partnerships across the state in the areas of agriculture, human, and animal science. It's my vision for Oklahoma to become a top 10 state. But I think the Oklahoma Pandemic Center can create a public health response capability that not only is top 10, but is #1 in the nation. And I'd like to thank Dr. Fry for all your hard work putting this together, Secretary Pollard, Secretary Corbett, Secretary Blaine Arthur, Secretary David Ostro, Secretary John Budd, for all the work that went into putting this together. Many other state and community leaders who have also worked tirelessly to get this project off the ground. I know all of Oklahoma will benefit from the Oklahoma Pandemic Center for Innovation and Excellence for many, many years to come. This is a landmark victory for Oklahoma and the entire nation. I'd like to turn it over now to Secretary Elizabeth Pollard, our Secretary of Science and Innovation, to kind of tell you more of the details about this center. Secretary Pollard.
Thank you, Governor Stitt, for your continued leadership of our great state. And thank you, everyone in attendance today, for this exciting announcement. The Oklahoma Pandemic Center is established from a long-standing structure of innovative public health response, as well as our state's unique attributes that together will lead public health innovation and excellence to new heights. Today would not be possible without a lot of hard work put in by our state and legislative leadership, who have positioned Oklahoma as a national leader. Our state's response to COVID-19 testing and the novel way that we leveraged our universities, public health lab, and partnerships, which include OSU College of Veterinary Medicine, OSU Medicine, OU Medicine, OMRF, our agricultural response, OBI, IMI, Rutgers Infinite Biologics, Thermo Fisher Scientific, Google, and many others created a unique foundation for how we move forward in the COVID-19 era and beyond. So we are best prepared for next time and able to not only meet the needs of Oklahomans, but for the nation as well. The Oklahoma Pandemic Center will become the national model for the adoption and implementation of a comprehensive approach to promoting and preserving public health. Oklahoma is the perfect intersection of urban, rural, and tribal communities, agriculture, animal and human medicine, and public and private partnerships, which makes this the opportune state to spearhead public response for not only our state, but for the nation and for the globe. Over the coming weeks and months, we will work swiftly to establish the Oklahoma Pandemic Center as a virtual umbrella that administratively ties together capabilities across the state, establish partnerships with commerce, and create new laboratory and research opportunities within the walls of the traditional public health laboratory. The Oklahoma Pandemic Center will be the next generation of public health response. Now, I'd like to ask the Secretary of Health and Mental Health, Kevin Corbett, to come forward to give his remarks.
What a beautiful day. Thank you, Secretary Pollard, for your leadership of this tremendous initiative. You know, the Oklahoma Pandemic Center would not have been possible without your leadership, that of Governor Stitt, Dr. Fry, our legislative leaders, and countless others who were thoughtful in setting up a structure that is sustainable for such an innovative center. Because of this structure, we have been able to quickly leverage those assets to create the Oklahoma Pandemic Center at a time when it is more needed than ever. The Oklahoma Pandemic Center will allow us to capture the best of Oklahoma has to offer at the local, state, and private industry levels with a distinct lens that focuses both on rural and urban needs. It will also allow us to capitalize on the expertise of our state in both animal and human health as we seek to lead in understanding and combating pandemic disease. The Oklahoma Pandemic Center is key to our ability to more agile addressing public health needs and building something sustainable that will benefit Oklahomans for the years to come. And now I'd like to ask Secretary Arthur to come and give her comments.
Thank you, Secretary Corbett. Good morning. One of the most unique aspects of our state is our extensive knowledge of agriculture, human, and animal medicine. The Oklahoma Pandemic Center will incorporate the best of all these areas. Leveraging Oklahoma State University's rural expertise in agriculture and animal medicine, along with University of Oklahoma's urban expertise in human medicine, as well as private research investments, will help us create a center for innovation and excellence at the highest caliber. Animal health and medicine has been crucial to our state's understanding of and response to the pandemic. Oklahoma, as a largely rural and agricultural state, is uniquely positioned to capture the benefits of animal science insights that can improve human public health. Choosing to relocate the public health lab and establish the Pandemic Center in rural Oklahoma will allow us to leverage this expertise as we plan for the future public health response globally. I'd now like to turn it back over to Dr. Lance Fry.
The Oklahoma Pandemic Center for Innovation and Excellence is the result of innovative public and private partnerships, without which none of this would be possible. There are too many to name, but please know that we thank each of you for your continued support in promoting and preserving global public health. This initiative will position Oklahoma to be a top 10 state in healthcare innovation and pandemic preparedness. We'll now take any questions that you have. It is going to be brick and mortar, and Elizabeth, Secretary Pollard, if you'd like to answer some of those questions.
Thank you for that question. So, of course, we still have a public health lab today with an operating budget that continues to fund our efforts for Greater Oklahoma. That will continue. In addition, there is some CARES money that is available that we will be utilizing for this purpose between now and the end of the year. And our legislature has been very forward-thinking as they put in place a bond that could be executed on several years ago for the building out of a new public health lab. And that will be utilized for the building of that facility as we progress. The public health lab will move to an interim location over the next couple of years while that building project gets initiated and is underway. The bond is for $58.5 million. The Pandemic Center is a virtual umbrella that helps tie together our public health response. So as a result, the Public Health Lab will be expanding to have greater capability to respond to a pandemic by uniting a lot of the assets we already have in the state around both agriculture, animal health, as well as our human medicine response. So as we did within the COVID response around testing, we partnered across our universities, as I mentioned, OU, OSU, OMRF, ME Labs, OBI, and we will continue to work to leverage those partnerships to provide a greater testing and R&D response for the purpose of pandemic preparedness. Sure. I need to return that back to the Department of Health because that is their budget, and I think it's best addressed by Dr. Fry.
So our current public health budget, that operation budget, is what's going to cover the initial expenses, along with the, as we start to build out, we'll use the bond for the additional building. We have a budget that's already been in the budget. It's should not be a greater expense during the initial transition. And of course, if there's a possibility of we're trying to best utilize the CARES money before the end of the year. So if there's a possibility of using some of that for the project, we're going to do that as well.
How much CARES money do you think?
Do you know? I'm going to get Travis Kirkpatrick. This is underneath his portion of the agency to go through the specifics on that.
Good morning. So could you repeat the question, please?
I was just curious how much CARES money.
Yes. So there's an enhanced testing project that was confirmed by the CARES Forward Committee that is approximately $50 million. We've earmarked $25 million of that money that continues to be available for this project. So the initial move of the Public Health Lab will incorporate some different realities that we'll have to face with different pieces to retrofit our new location. And we anticipate using the CARES funding to supplement that so we can make that move happen by the end of the year. And then, as Secretary Pollard mentioned, use of the bond that was so forward-thinking of our legislature to create to build the larger piece. Yeah, so the current budget is approximately $9.5 million is the current Public Health Lab budget, which is the appropriated funding. That doesn't incorporate some of the federal match funding that we do realize. We have looked, and in our initial analysis, we don't anticipate seeing anything but a flat budget for the next 2 years. So that incorporates this move, which would have the CARES Act funding, and then year 2 in our new facility. There's certain realities that we know we're taking into consideration as we move forward, but we don't anticipate an addition. So I can return that question to Commissioner Fry if you like.
Well, I can't speak about the past, but I can say that we are in a situation that's allowed us to really bring to our attention different parts of our agency that needed to be completely redone, basically. So this crisis has brought to the forefront different sections that we could see were antiquated and need to be fixed. And the public health lab is one of those areas. You know, we started out with, again, testing capacity of probably 100 tests per day. And through the partnerships that we've developed in the state, that we're up to about 6,500 a day now. But this is really investing in the future of Oklahoma and investing in the future response and investing in our in-state capacity. And that's why we're using it now. We are expecting more to come. Just think about Ebola, different things that have happened in the past, the frequency of these and the possibility of things happening in the future is definitely something we want to be planned for. With this response, you can see that we hadn't invested in infrastructure. We weren't really well prepared for it, and we want to make sure that doesn't happen again. Absolutely, part of it goes with what we're dealing with right now, because this is it's a pandemic. We are dealing with this, and the lab, the continued development of our laboratory system and our public health lab network that we have is crucial to this. And it's much more than just that. It's going to be more inclusive. Initially, we will be using the same staff that we have, but when we're partnering with these other agencies to bring on new techniques and specialties that we weren't doing before, for instance, partnering with the veterinary lab system and the agriculture. I mean, we have to bring in expertise for those areas. It's going to be in Stillwater, and it's going to be a very quick timeline. We've already are in the phases of finalizing the lease on the property where it's going to be moved to. You know, I'm not sure why the board was not used in its advisory capacity early on during the pandemic response. I can tell you that since I became the commissioner, I've reached out and spoken with every single one of them individually and talked to them about it and had that conversation and had discussions about how we could move forward and use them in an appropriate advisory position. And they were recently moved prior to my becoming commissioner from their prior board to the advisory board, and I think they are all struggling with that themselves and trying to figure out what that means and what the proper format for that to occur.
So what have they told you about what they think needs to happen? If you talk to them, what have they told you? Because that's not what they said yesterday at the top. They said they have not been asked for their advice about anything. So what have they shared with you about?
They shared their frustrations about being in an advisory capacity, and well, as I said, I reached out to them and established contact and told them that we need to meet to figure out what that means and how we're going to put that together and move forward. I think they're just very frustrated over the fact that they used to have more power and authority over the department, and they don't have that as much right now. And so we're all kind of working our way through this to figure out how to best use an advisory committee.
If they're not making recommendations or advice, who is streamlining the entire plan of how our response is done?
It's been a multi-agency response. Originally when the governor put together the Governor Solution Task Force and brought in a lot of people that were expertise to come together to try to help develop this. They came together and worked 7 days a week, all the time. We briefed the governor 7 days a week for months. And overall, we had an incredible response. We did exactly what they needed to do at the time, which was to push the curve off and flatten it until we could build up our healthcare supplies at our capacity within the state, which is exactly what they did.
Real quick, I'm sorry. You touched on this a little bit earlier. Can you talk about what might have been better, or what, if this had been in place and your goals were in place 7 months ago, what would have been better? What would we have seen different?
Absolutely, and I'm sure Secretary Pollard can follow me on this too. But in general, with our entire response that we had, one of the biggest struggles that we had was the lack of investing in our infrastructure. We were dealing with very antiquated systems. Everything, quite honestly, pretty much everything we have in our old building is antiquated. I don't know if you've ever been in there or not, but it needs some help. So if I could say one thing that we needed to do was invest in infrastructure. That's what we're doing now. We're trying to invest and we're trying to prepare. If we would have done this, we would have been miles ahead. Again, we started with no test capacity. We struggled for a long time to get to where we are, and it was only through innovative thinking and partnerships that we actually are where we are today. Secretary Pollard?
Let me just follow on to that, because this is really a great opportunity for the state of Oklahoma, and I think we need to get our heads around the fact that this will become the first in our nation of a pandemic response center right here in Oklahoma, and it's because of our unique assets that we can pull together. One of the reasons that the Pandemic Center is forming is because we uniquely leveraged partnerships, not only our state assets, we talked about the universities, but with commercial, private organizations who come around us to help us stand up during this pandemic. The likes of Google, who are here today, Thermo Fisher Scientific, who is endorsing this project as well, and Rutgers University, whose RUCDR Infinite Biologics facility really has been integral in helping us define how we can improve our testing capability. As Dr. Fry mentioned, we went from 100 tests in March to over 6,500 a day now. That's just what the state provides. That doesn't include other state-related commerce that provides testing, but that's just our public health response. And we need to do even better than that. If we were able to provide 100,000 tests per day, we'd be turning around a response much more quickly. And those commercial partners like Walmart, CVS, Walgreens would be partnering with our state directly on that testing rather than sending those tests out of state. And that's where we can do better. This center is much more than testing. It's going to be leveraging our biospecimens, specimens that we've gotten through assets in our Purdue settlement, but also assets that we've gotten as a result of COVID and other future pandemic situations. But we also need to be doing that for animal health, and we need to be doing that for our agricultural response. This center will have not only testing capabilities, but the ability to have mobile units that can be deployed that will allow us to actually store specimens, as well as bring new testing capability to the state. as we move towards more personalized medicine approaches to testing, which COVID is one of those, but there's much more complex testing to come. In addition, as our federal response has really moved away from the World Health Organization in how we're going to be responding to these opportunities that we have in front of us, to do that for the population of Oklahoma, the nation, the globe. They're looking for ways that our own state can step up and provide that capability. So that is what the Pandemic Center is. This is much more beyond just Oklahoma, but it's first and foremost for Oklahomans, and that's why it's being positioned as a rural center of excellence.
Dr. Fry, you spoke yesterday about making some changes to the COVID-19 dashboard, specifically saying backing off on it somewhat. What's that mean?
Yes, well, we want to. Data is incredibly important. We understand that, and we want to put the data out there that we need to have. But we want to really move away from just data to more information. So we want to use that data to inform decisions and be more proactive than reactive. When you're talking about the numbers, you're always talking about the past, and that's more of a reactive position, and we want to clean that up some. Also, we have flooded everyone with so much data, and it doesn't just appear, magically. There are people back there doing it, and they do that 7 days a week and have been doing it for months. And so we really have to figure out what is really needed and clean some of that up. I remember this came about because I was talking about a slide from the governor's brief, and I said, which slide was that? And they said, that's slide 50. I'm like, slide 50? And they're like, yeah, we've got probably 75 slides that they update all the time, every day, and they have them there just in case we need them. But they don't show all of them, of course, every time. Sure. Absolutely. I'm going to get Matt Stacy to talk about it because he's been really working with the Hospital Association daily on this, and so we'll get him to give you a brief update.
Yeah, you bet. My name is Lieutenant Colonel Matt Stacy, S-T-A-C-Y. And I'm sorry, sir, I didn't hear the whole question. Would you mind repeating the question for me? Right. Yeah, absolutely. Yeah. So what the surge contracts we're referencing, those ended on September the 21st, and those for a 60-day term. Prior to that, we had a different set of contracts in place, and so we are working daily. Matter of fact, on the way to this press conference, I was speaking with the Oklahoma Hospital Association on the phone. We're working to refine the surge plan triggers within that, and on a daily basis monitoring the surge bed capacity, the capacity of the hospitals to receive patients. And I understand there's been a recent article that I participated in and gave some comments to, and that article remains true. I mean, we are on a daily basis vigilantly watching these numbers and working directly with. We're blessed to have a very fortunate to have a great hospital system here and really good hospital administration, and we work with them daily. Everybody on this panel talks to those CEOs almost on a daily basis, to include myself. Yeah, right. So I think it's important that we distinguish surge plans for you. So every hospital system has an internal surge plan, and that internal surge plan includes the adjustment of the patient levels, the staffing levels, and the option to no longer take on certain elective surgeries. Okay, and so hospitals have the ability to internally initiate those surge plans, and if they needed to, they will do that. So externally to that, we had a Oklahoma State hospital surge plan that was facilitated with CARES funding, and that was secured beds. It provided additional capacity to the state. Matter of fact, 245 additional beds during the contract period that we were supplementing with funding. And during the period that those contracts were in place, on average, we averaged in the range of between 60 to 70 of those beds being used at any one time, of 245 beds. Okay, so that's an important distinction for the state of Oklahoma, and it's also, I think it's important for everybody to understand, and for the state to understand, that those surge beds, even though those contracts are now canceled, we have the option to turn those back on. There's a period to do that, In addition to that, we also have a long-standing contract from the very first surge plan with Integris Hospital System to activate 95 beds there should the need arise. And so we understand that hospitals we understand they're stressed with COVID patients, and it's tough because this is the situation. I think everybody has felt this, right? Business owners are feeling this, Oklahomans are feeling this, teachers are feeling this, parents with children in school are feeling this, and hospitals are feeling this too. And so we've moved a lot of pieces to really support these hospitals through this and to support Oklahoma patients, and we're continuing to do so. We're choosing to do so in a longer term fashion through some of the things you're seeing here. Investment in the future, investment beyond year 2020 when CARES funding runs out. We're trying to invest in the future of our response capabilities for the state.
Regarding that search plan, since you said on the way here, you guys are actively working on contracts to get new contracts in place?
Yeah, just a correction. We are working with the Hospital Association and the hospital CEOs to adjust the surge plan triggers and tiers that are within there. The option of getting new contracts in place, I would say that's not what we're looking at this time. We're looking at how do we adjust that funding to something that is more long-standing. We were doing what was equivalent of renting beds, right? And it was a really good insurance policy for the state of Oklahoma during a period that we didn't know where numbers were going to go. And I think now we have 7 months of data, and we have a very good state epidemiologist helping us forecast that, and we're working with the hospitals to forecast that as well. And so we're looking at deploying that money that is an expiring asset. That money expires at the end of the year, that federal CARES money, and we're looking at trying to deploy that into something that will last beyond the New Year's holiday, right?
We've heard from hospitals. We heard about a patient just last night who went to a hospital in Claremore, couldn't get into an ICU bed in Tulsa, couldn't get in Joplin, couldn't get in Kansas City, finally got in Oklahoma City, and then passed away yesterday morning, 51-year-old man. Moving forward with all of this innovation, will you guys be working to get some sort of a portal that all the hospitals can use? It seems like right now, the hospitals, I know they're working together. I've heard from the Tulsa hospital that they are working together, but as you know, day by day, hour by hour, their bed capacity changes and their staffing. Will you guys be working to get some sort of a portal that all of the hospitals can use so that if somebody is in need of ICU care, especially for COVID right now, or anything else, they can get into a bed and it won't be so hard to figure out where there is a bed available?
Yeah, it's an excellent question, and I appreciate you asking it. And I would say that's one of the many ideas that we are exploring in collaboration with the hospitals and the Oklahoma Hospital Association. We're exploring that concept. I think that we, as a state government, are very careful to not direct the flow that impacts private hospitals. Right? These hospitals have a transfer system that they use. They have a very established system. They've been around for a long time. They're able to manage their own patient load and their staff load. And if we get to the point where we do have through our TREC system and through some statutory framework that if we were to initiate it, we do have the ability to direct patients. But that's an emergent situation. And this pandemic, has been emergent at times. Right now, we're at a situation where we're trying to aid the hospitals in transferring patients and their patient load versus directing patients. Because at the point that the government gets in and makes patient care decisions, I think that's contrary to the best interest of Oklahomans when you have physicians and hospital systems that they treat patients every day making those patient care decisions.